Tudo bem, pessoal? Nós estamos de novo aqui no SBU in situ AUA 22 e nós vamos falar com o Dr. Faysal Yafi a respeito do uso da testosterona. And thank you, Yafi, for being here with us. We are from Brazil, and you speak about testosterone and which testosterone I give to my patient. Can you give me a brief and take-home message for the Brazilian?
Yeah, so thank you, first of all, for having me and for talking to me. So when we talk about testosterone, historically, we only had a few options for testosterone therapy. The landscape is changing. We have many options now. We have historically injectable testosterone and topical testosterone. But with time, we've developed other options, testosterone pellets, we have oral testosterone, we have intranasal spray testosterone. And so now when you're talking to a patient, there are many options and there are a lot of considerations into what is the best option for the patient that you're seeing.
Well, in Brazil, we don't have the options about the short action, new short action, really, about testo and now the new oral drugs. Can you take a brief about these short action options?
Yeah. So when we talk about the new options, Natesto is an intranasal spray. So the advantage of the intranasal spray, it works very fast. So mechanism of action, within an hour, patient peaks, and it's taken 2 or 3 times a day. So you're getting multiple peaks. And benefit of this is it doesn't suppress FSH and LH as much as other testosterone options. So potentially it may preserve sperm parameters to a certain extent. So in well-motivated, well-counseled patients, you may consider it as an option if they're trying to preserve fertility. Now, we don't know what's going to happen 12 months, 2 years afterwards. Probably it will suppress fertility completely at that point, but it is an option. The other benefit of Natesto is it has less erythrocytosis, so which is a problem that we see with injectable testosterone. So the hematocrit goes up and sometimes you need to do phlebotomies. Natesto has less erythrocytosis rate. So these are the advantages of it. And then with regards to oral testosterone, in the US we haven't had oral testosterone since about 2019. And the reason is oral testosterone was methylated, 17-alpha methylation. And because of that, it went through liver first pass metabolism, and that caused liver toxicity, liver cirrhosis, etc. So for that reason, it was never FDA approved. The new oral testosterone therapies, one was approved in 2019, it's called Getenzo, and the other one was approved in 2021, it's called Tilando. The advantages of these options is because they're not methylated, they bypass liver first metabolism and they go through the intestinal absorption. So no effect on liver toxicity. They're usually taken twice a day with meals. Historically, you needed to take a big fat intake meal for them to be absorbed, but the newest medication, especially Tilando, has shown that regardless of what food you eat, as long as you're not fasting, you're going to absorb it, which is really nice. They have probably less erythrocytosis rates, and we don't know what their effect is going to be on fertility because they're short acting, so they might have, some impact on fertility, which is similar to what we see with Natesto. So there is a big demand for new options. It just makes the conversation with the patients now longer because you have to talk to them about 7, 8 options instead of 1 or 2.
Yeah, that's nice, and probably if that gets in Brazil, it'd be an option for us too. Just a little comment, we have a little controversy in Brazil because we don't have pellets even. So you have testopel here, and there in Brazil we use all the manipulated things, and we are like controversy about financial things. What do you mind about the pellets? It's an option, you have only one option here. Do you use it even more? What about it?
Yes, so testosterone pellets are a good option for patients, particularly I have a lot of patients who travel a lot or patients who are not compliant with treatment. So they're not going to take the pills, they're not going to give themselves shots, so the pellets are good. The problem with testosterone pellets is in the US is the same as Brazil. We don't only have the branded Testopel. A lot of physicians, and especially cash-based clinics, are giving the generic or other developed testosterone pellets. And the problem with these, the conversions are not clear. So while testosterone pellets, usually each pellet is 75 milligrams of crystalline testosterone, the other pellets, you don't know what the equivalence is. So I have patients who are taking 3 pellets from outside clinics, and they come in and their testosterons are 1800, and so the conversion is not clear. So this is the biggest concern with testosterone pellets. They have a role. But again, as long as you know what you're giving the patient, I don't have a problem with generic, but you have to be sure that you're giving the patient the right dose. And generic medications, sometimes you don't know what you're getting.
Yeah, nice. That's a great overview about testosterone replacement. So thank you, Yafi, again, and hope you can go with us in Brazil soon. You are invited already.
It's my pleasure. It would be my pleasure to go there. Obrigado.
Thank you.